The UK's worst day yet.
Unless we slow the spread of this virus, then as we've seen, those numbers will continue to rise.
The Olympics postponed.
Clearly, the integrity of the competition was going to disappear.
And how quickly could a vaccine be mass-produced? This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis. The UK's recorded the highest number of coronavirus deaths in one day, after another 87 people died, bringing the total number of lives lost to 422. The Health Secretary, Matt Hancock, launched an appeal for over 250,000 people to help the NHS deal with the UK's outbreak.
We're seeking 250,000 volunteers, people in good health, to help the NHS for shopping and for delivery of medicines, and to support those who are shielded to protect their own health.
Over 5,000 final year medics and nurses will also move to the front line to bolster the health service. And London's Excel Centre is to be turned into a 500-bed field hospital by the Army within days. The news came amid warnings that tighter restrictions may be brought in if the public flout Boris Johnson's rules on social distancing. The police have started breaking up gatherings of more than 2 people, with the Health Secretary warning of unlimited fines for those who disobey. They've been cancelled altogether at times of world war, but never before postponed. The 2020 Olympic and Paralympics, due to take place in Tokyo, will now go ahead in 2021. It comes after the president of the International Olympic Committee, Thomas Bach, agreed to Japan's unprecedented suggestion of a delay. Canada became the first major country to withdraw from both events on Sunday. Athletics' US governing body had also called for a postponement. The financial blow of cancelling the Games will be substantial for Japan. The country's already invested at least $12.5 billion into the event. By some estimates, postponement would reduce Japan's annual GDP growth by 1.4%. But World Athletics President Seb Coe told Sky News the decision would come as good news to the athletes.
If you are fighting to preserve the integrity of competition, which is really an Olympic value, then to have athletes that are simply locked in their houses, not able to train, not able to use public facilities, and that's for some of them that are in better situations than others, then clearly the integrity of the competition was going to disappear. And also, we needed to give the athletes absolute certainty that they weren't going to be forced into either breaking government edicts or public health authority edicts.
Pressures mounting on the government to provide greater support for those who are self-employed. While full-time employees losing work to coronavirus have been promised 80% of their income, freelancers will have to survive on just 25% of their typical earnings. That's because they'll have to rely on benefits paid at the same rate as statutory sick pay, just over £94 a week. Chancellor Rishi Sunak says it's incredibly complicated to create a system to support the self-employed. The Telegraph's personal finance reporter Mariana Hunt explains why.
That's because there's a chance that extra support could be open to abuse by people who are better off. People are also worried that payments will be calculated based on your earnings over the past 2 years. For those that have only recently become their own boss and have just started to pick up business, that could really disadvantage them. But somehow the Chancellor is going to have to find a fair way to make up this lost income. And how he plans to do it is going to be announced imminently. We could follow Norway's example and promise to pay the self-employed 80% of their average yearly earnings over the past 3 years. Or we could copy what they're doing in France and offer a flat payment for self-employed people who have seen their turnover drop by more than 70%. Or we could take a completely different approach. We're still waiting for answers, but for people with empty work diaries and bills to pay, those answers can't come soon enough.
After more than 2 months on lockdown, strict measures are easing in Wuhan, the Chinese city at the centre of the outbreak. Inside the city, people are already allowed to move about, subject to some restrictions. And from April the 8th, those testing negatively for the virus will be allowed to leave altogether. Over 100,000 people are now recorded as having recovered from the coronavirus globally, and China has a recovery rate of 89%. But so far, only about 2% of coronavirus patients in the UK have recovered. So why the huge discrepancy? And why is the UK's recovery rate quite so low? The Telegraph's Lizzie Roberts says the figures aren't actually as alarming as they might seem.
The reason why the UK's rate is so low is because we're actually still lagging behind other countries and we are yet to reach the exponential phase of our outbreak. China recorded their first case in November, so they're much further along the curve than us. Similarly, while Italy did confirm their first case around the same time as the UK, the growth curve of infections only really began to rise in the last week or so here. And early estimates do suggest that patients take around 10 days to recover after first falling ill. So we still have another couple of weeks to go before our recovery rate will begin to increase as patients begin to improve. Experts also predict that by the time we hit the actual peak of our outbreak, our recovery rate will just start to mirror that of other countries. The way Public Health England is recording official recoveries is also having an impact. So there is also the potential that patients may have been tested positive, which is recorded in the official figures, but then because they recovered at home and not discharged from an NHS service, they won't be officially recorded as recovered.
Around 35 companies and academic institutions are racing to create a vaccine. One, produced by a Boston-based biotech firm, has already started testing on humans. It's broken records for the speed at which the trials got off the ground. Plenty of you have been emailing in with questions about such a vaccine, primarily when it'll be ready. Well, scientists say the beginning of next year at the earliest. But a listener called Richard asked about large-scale vaccine production. He wanted to know how challenging it would be to produce a COVID-19 vaccine on a mass scale once one had been developed. Richard, I put your question to Dr. Al Edwards. He's the Associate Professor of Biomedical Technology at the Reading School of Pharmacy.
I think it's important to be clear that this is something the UK has been aware of for some time, and that significant effort has gone into creating centres for vaccine manufacturing, and there are a number of these now in the UK. But still, that's different from having a large commercial facility that produces large doses of a vaccine product. I think another thing to be really clear about is that it's very hard to justify having a factory that might sit around just waiting, ready for the next emerging infection or outbreak. And so it's understandable to have a situation where all the vaccine manufacturing capacity in the world is already dedicated to producing particular vaccines and particular products. And so perhaps it's unreasonable to expect those can suddenly switch and start making a different vaccine. Supposing we could switch off influenza manufacturing in a flu vaccine company to make a new vaccine against COVID-19, we then maybe run out of influenza vaccine, and that could cause as much harm as the COVID-19 virus.
If you have a question you'd like one of our experts to answer, maybe you're confused about government policy, or perhaps you'd like advice on how to talk to a younger family member about the crisis, email me. It's coronaviruspodcast@telegraph.co.uk. This is Coronavirus, the latest from the Telegraph. I'm Theodora Louloudis, and I'll be back on Wednesday evening with another update. In the meantime, Paul Nuki, who you will have heard on this podcast, and our brilliant global health security team are here to provide unrivaled insight into the science behind the battle to defeat COVID-19. They're a unique group of journalists among newspapers and have been covering issues like this for more than 2 years. News and information that you can trust is more important now than ever. But producing it and supporting our world-class journalists is an expensive endeavour. Our subscribers are the ones who make it possible. Please do consider joining them. If you subscribe today, you can access all the journalism on our website free for the first month, and for just £3 a week for your next 3 months. Go to telegraph.co.uk/audio.